Hello, welcome to this video. My name is Christiana Mausisera. I would like to talk about, few things that as a young lady, as an adolescent girl, as a woman, you should always discuss with your doctor or with your gynecologist. The first one is painful periods or painful menses. If you experience during your menses, you experience severe abdominal pain, you have cramps, you can barely, do anything, you have headaches, you have severe soreness of your breast. Sometimes you have to take, medication to be able to cope or do anything. You need to seek medical care. That could be a sign of uterine fibroid. It could be that you have endometriosis, which is a condition where the tissue that lines your womb grows outside the womb. So it could grow on your ovaries, it could grow even on the intestine. So during your menses, you'll be experiencing very severe pain. So it's important to get, examined and then you're assisted or managed, by your doctor. The next one is vaginal odor. So if you notice any change in the smell of your vagina has its natural, smell. So if you notice any foul smell or a fishy odor emanating from your vagina, it may be a sign of overgrowth of bacteria in your vagina. It may be vaginal infection. It may, if you are sexually active, it may be a sexually transmitted infection. It may be a sign. So please get examined and treated. And sometimes people go to the pharmacy or anywhere to get medications to treat themselves because of the embarrassment, or they feel ashamed of going to see the doctor, or they feel they may be judged. No. Sometimes you take those medicines and it's as if the thing has stopped. The odor has resolved. There is no discharge and nothing again. Then you feel you are okay. But sometimes the infection has moved upwards. It has ascended to the other parts of your reproductive system, your cervix, your womb, and even your tubes, your fallopian tubes. So it can result in scarring or blockage of your tubes. And when you want to get pregnant, it becomes difficult. So please don't self-medicate. If you have any, vaginal odor, discharge, any changes there, seek medical care. The next one is if you experience low libido. Libido simply means the desire to have, sexual intercourse, or the desire to be intimate with your partner. So if you've noticed a sharp decline, it could maybe if you have, dryness of your vagina. In fact, dryness of the vagina often occurs in menopause, but in young people, yes, it can occur under certain circumstances. For instance, if you are taking a birth control pill, as a side effect, you may have dryness of the vagina, but that can be managed, so please seek medical care. If you experience pain during sexual intercourse, don't take it for granted, especially if you've tried other positions but still the pain is there. You've tried a water-based lubricant or lube. You've tried using lube, but still the pain is there. Please, I would advise you to seek medical care. Then the next one is if you notice any swelling or bumps or pimple around your genital, it's important to seek care. In fact, it's normal for the razor bumps to resolve on their own, but if you notice something, unusual or different, it could be genital wart. And genital wart, when it appears, it may stay for some time. So, and it's very, very contagious. So if you have unprotected sex with somebody, or the fact that somebody is having sex with you comes in contact with it, could get infected with the HPV virus. It's caused by the human papilloma virus, the HPV. So please seek medical attention or discuss with your doctor. Don't assume it's normal and suffer in silence. For instance, another reason why you should tell your doctor if you have any, rash or bumps or swelling around your genital is that it may be a herpes lesion. And for herpes lesions, they disappear within 1 to 2 weeks, 7 to 14 days. It will disappear, but it doesn't mean that the infection has resolved. Herpes is actually lifelong infection. So periodically you'll be getting outbreaks. You are there and you get the lesions around your genitals, and then you could also get some sores on your lips, you know. So please seek medical care so that you know exactly what is going on, what you are dealing with, and how to go about it. Then the next one is your sexual history. In fact, sometimes when women come to see the doctor, and then the doctor asks you, when was the first time you had sex? The age at which you started having sex. Some people will tell lies. Doctor will ask you, how many sexual partners have you had? What were their ages? Some people will still tell lies. And then the doctor asks you, have you ever been treated for any sexually transmitted infections? You will say no. Perhaps you were treated for gonorrhea or syphilis. In fact, all these questions, the doctor does not ask them just for fun. But, you know, it helps the doctor to be able to, anticipate or look out for any, your risk for certain complications. For example, if you've had sex, your first sexual intercourse was before age 18, the research has shown that there are higher chances that you could be infected with the HPV, that's the human papilloma virus. And the reason is that if you've had your first sexual intercourse at age 15 or let's say 16, by the time you are, let's say 30 years, you would have had, a number of sexual partners within that period if you are not in a monogamous relationship. So that alone exposes you to getting infected by, your sexual partners. So the doctor is just asking to be able to, know the risk that you may have, and then see how possible they can help you. And for adolescents or for the younger ladies, your cervix, there is an area of your cervix that is known as the transformation zone, where the cells there undergo rapid change. And for younger women, that area of their cervix is very prominent. It's more exposed than in adults. So what it does is that it puts you at risk of, getting, abnormal changes in the cells around your cervix, and that could also result in cervical cancer. So please, it's important to have protected sex. And if, you go and your doctor asks you questions that are about your sexual life, open up and answer the questions correctly so that your doctor or gynecologist can help you, better. Then another point is if you experience leakage of urine or feces, especially, and this is common especially after childbirth. It can occur in menopause too. Now, especially women who have had delivered very big babies, or they've had vaginal delivery that's in which they were assisted to get baby out. So maybe they've used the forceps or they've used vacuum to help the baby come out of the vagina. Usually, these women are at risk of developing, incontinence, or it could even be fistula. So please seek medical care so that it will be, detected early and be repaired. It can be repaired, surgically, so that, you are free and you have a good quality of life. So please don't just, relax and then assume it's normal and suffer in silence. Anything that you feel is unusual or uncomfortable, seek medical care and open up. Thank you, and please watch out for more videos. Bye.